बिस्मिल्लाहिर्रहमानिर्रहीम। प्रोफेशनल कम्युनिकेशन BSN थर्ड सेमेस्टर एग्ज़ाम के लिए इम्पोर्टेंट MCQs डिस्कस करते हैं। MCQs नंबर 1, व्हाट आर द गोल्स ऑफ कम्युनिकेशन इन नर्सिंग प्रोफेशन। नर्सिंग प्रोफेशनल में कम्युनिकेशन का मेन मकसद क्या है? एस्टेब्लिश ट्रस्ट, रिस्पेक्ट, प्रोवाइडिंग इमोशनल सपोर्ट। ऑप्शन डी, ऑल ऑफ दीज। MCQs 2, what is purpose of working phase? Working phase, option A, collaborative problem solving. Option A is correct. Techniques of therapeutic communication are active listening, empathy, trust, confidence. Option A, active listening. Repeat the words of patient is known as reflecting, restating, is called restating. Option C is correct. Challenges in communication: language difference, emotional barrier, physical barrier, all of the above. 6. What is the primary purpose of professional communication? To entertain colleagues, to build social relationship, vocabulary. Option C, to exchange information clearly and effective workplace. Option C is correct. 7. Which of the following is an example of formal professional communication? Option A, chatting on social media. B, sending a text message with emojis. Option C, writing an official email to a supervisor is a formal professional. Option C is correct. 8. In professional communication, active listening involves thinking about your response with the person speaking, interpreting to clarify quickly, focusing fully on the speaker, and respect appropriately. Option C is correct. 9. Which of the following is considered a barrier to professional communication? Feedback, respectful tone, jargon, or technical language the receiver ununderstand. Option C is correct. 10. When giving constructive feedback in a professional setting, it is important to uh, criticize the person directly. Option B, use vague statement. Option C, focus on specific behaviors, not personal traits. Option C is correct. 11. Non-verbal communication in a professional setting include email formatting, spoken language. Option C, eye contact and body postures is a non-verbal. 12. Which of the following is an example of a low context culture? Japan, Saudi Arabia, United States. Option C. What is ethnocentrism? The ability to adapt to different culture superior to other is called ethnocentrism, mean the ability. Or option B, respect for other cultures. Option C, believes that one's own culture is superior to others. अपनी ही कल्चर को अच्छा मानना हर किसी ने, तो दिस इज कॉल्ड एथनोसेंट्रिज्म. 14. Which of the following can be a barrier to effective cross cultural communication? Active listening and cultural stereotype. बैरियर टू इफेक्टिव क्रॉस कल्चर जो है वो कल्चरल स्टीरियोटाइप है. ऑप्शन बी इज करेक्ट. 15. इन हाई कॉन्टेक्स्ट कल्चर कम्युनिकेशन इज ओपन, डायरेक्ट एंड एक्सप्लिसिट. बी, रिप्लेइंग heavily on written instructions agreement. Option C, indirect and relies on non-verbal cues. हाई कॉन्टेक्स्ट कल्चर इंडिया, पाकिस्तान, ये इसके एग्जाम्पल है. 16. Which of the following is an example of verbal communication? Facial expression, handshake, or written letter is a verbal. Option C. Non-verbal communication include all of the following except gesture, tone of voice. Spoken words is not included. Option C is correct. Which of the following is considered a paraverbal feature of communication? Body language. Option B, tone, pitch and volume of the voice. para-verbal feature of communication. Option B is correct. 19. What does non-verbal communication often convey more effectively than verbal communication? Complex theories. Option B. Personal feeling and emotions. Historical facts. Instruction. Option B is correct. Personal feelings and emotion. 20. Which of the following is a form of non-verbal communication? Asking a question, typing a report, crossing your arms. No. Option C. Option C is correct. The most powerful non-verbal communication is often considered to be hand gestures, clothing, facial expression. Option C. 22. Which of the following is not a characteristic of effective verbal communication? Clarity, appropriate tone, active listening, eye contact. Eye contact is not characteristic of the effective verbal communication. Uh, 23. Which of the following is an example of verbal communication? Facial expression, handshake, written letter. Option C. 24. Non-verbal communication include all of the following except gestures, tone of voice, spoken words. Option C. 25. Which of the following is considered paraverbal feature of communication? Tone, pitch, volume of voice. What does non-verbal communication often convey more effective than verbal communication? Complex theories. Option B. Personal feelings and emotions. Personal feeling and emotions नॉन वर्बल कम्युनिकेशन होता है जो ऑफन कन्वे मोर इफेक्टिव देन वर्बल. 27. Which of the following is a form of non-verbal communication? Asking question, typing a report, crossing your arm. Option C is correct. The most powerful non-verbal communication is often considered to be hand gesture, clothing, facial expression. So option C is correct. Which of the following is not a characteristic of effective verbal communication? Clarity, appropriate tone, active listening, eye contact. Not characteristic of effective verbal communication. No eye contact. Which of the following is essential for effective communication between healthcare professional and patients? Using medical jargon to appear knowledge. Option B. Active listening and empathy. Option B is correct. 31. What is the most important reason for using open-ended question in the patient interview? They reduce time spent with the patient. Option B. They require yes or no answer. Option C. They encourage detailed responses and understanding. Option C. 32. A nurse notes and maintains eye contact while the patient speaks. This is an example of a verbal communication. Option B. Aggressive communication. Option C. Non-verbal communication. Option C is correct. 33. Which of the following is a barrier to effective communication in a healthcare setting? Cultural sensitivity, use of plain language. Option C. Language difference. Option C is correct. 34. When dealing with a patient who is hard of hearing, the best communication strategy is to speak louder and faster. B. Uh, shout from a distance. Shoot from a distance. Option C. Face the patient and speak clearly. 35. Confidentiality in a patient communication is important because it avoids unnecessary paperwork. Option B. It helps with hospital uh, budgeting. Option C. It builds patient trust and complies with a health care provider's standards. Option C is correct. 36. What is the primary goal of communication in the nurse-patient relationship? To complete documentation. Option B, to give command to patient. Option C, to establish trust and provide quality. Option C is correct. 37. Which of the following is a therapeutic communication technique? Giving advice, changing the subject, active listening. Option C. 38. When the nurse repeats back what the patient has said to clarify understanding, this is called summarizing, reflecting. Option C, paraphrasing. तो इसको हम कहते हैं paraphrasing. 39. Which nonverbal behavior can enhance trust in a nurse-patient interaction? Avoiding eye contact, folding arms, maintaining appropriate eye contact. Option C. 40. The technique of using silence in communication allow the patient to feel ignored, reflect, and gather thoughts. Option B. Which of the following is not considered a barrier to effective communication? Cultural sensitivity is not the barrier. 42. Which communication style should a nurse use to assertively express concern without being aggressive? Passive aggressive, या assertive? Option D is correct. Assertive communication style should a nurse use to assertively express concern. 43. When a nurse responds with I understand this is difficult for you, it is an example of giving advice, showing empathy. Option B is correct. 44. What is the best response when the patient expresses fear about an oncoming procedure? Don't worry, it's nothing. Option B, why are you afraid? Option C, tell me more about your concerns. Option C is correct. 45. The nurse-patient relationship is built on which a fundamental element? Medical knowledge, hierarchy, trust, and respect. Option C is correct. Option 46. What type of question should a nurse use to encourage the patient to express their feeling? Closed-ended, leading. Option C, open-ended questions. 47. A patient becomes silent and withdrawn. Which should the nurse do first? Ignore the behavior, confront the patient. Option C, gently explore the cause of the behavior. Option C is correct. 48. Which of the following helps nurses ensures that communication with patient has been understood? Repeating the instruction louder, asking the patient to explain back in the words. Option B is correct. 49. Which behavior may negatively impact the therapeutic relationship? Maintaining patient confidentiality, showing empathy, judging the patient lifestyle choices. Option C is correct. 50. Which is an appropriate therapeutic communication technique when the patient is crying? Leaving the room to give them privacy. B, telling them not to cry. Option C, sitting quietly and offering tissues. Option C. 51. What is the basic purpose of communication? To entertain. Option B, to inform, persuade, or influence. Option B. 52. Which of the following is not a component of communication process? Calculator. 53. The process of converting ideas into the message is known as encoding. Which element of communication ensures that the message is understood correctly? Feedback. In face-to-face communication, the most significant form of communication is a non-verbal communication. An interference that disturb or distort the message is called noise. Communication is complete when the message is sent, a message is received, the receiver understands the message. Option C. Which of the following is an example of verbal communication? Facial expression. Option B. Written emails. 59. Which type of communication occur without using words? Non-verbal. Which is not the type of communication? Downward is not the type of communication. 61. Which of the following is a key principle of effective communication? Use of technical jargon. Option B. Clarity and conciseness. Option B. 62. In communication, the principles of feedback ensures silence is maintained, one-way communication, understanding and response. Option C. 63. A good communication must speak loudly use difficult words. Option C. Listen actively. Option C. 64. Which principle focuses on understanding the receiver background, knowledge and emotional state? Option A. Principle of empathy. 65. The principle of consistency in communication means the message should be repeated often. The message should contradict previous message. Option C. The message should align with the past communication. 66. Which of the following enhances therapeutic communication? Interrupting when the patient speaks, giving advice immediately. Option C. Maintaining eye contact and being respectful. Option C. The principle of completeness in communication implies using short message, providing all necessary information. Option B. 67. The principle of completeness in communication implies use short message, providing all necessary information. 68. The principle of courtesy in communication include being rude to make a point, arguing your opinion. Option C. Showing respect and politeness. Option C. 69. Which principle encourage the use of simple and familiar language? Principle of decoding, principle of clarity. Option B. 70. Effective communication should avoid clarity, jargon and ambiguity. Option B. Which of the following is a therapeutic communication technique? Active listening. 72. Which technique involves restating the patient message in the nurse own words is called paraphrasing. 73. Saying I understand how you feel is an example of giving approval. Option B. Empathy. 74. Which of the following is not a barrier to therapeutic communication? Using silence. Option A. 75. The nurse nods with the patient while the patient speaks. This is an example of verbal communication, non-verbal encouragement. Option C. 76. The first phase of nurse-patient relationship is working phase, orientation phase. Option B. 77. Which phase involve building trust and setting goals with the patient? Orientation phase. 78. During which phase is the nurse most actively involved in helping the patient meet goals? Orientation phase या working phase. Option B. 79. Saying goodbye and evaluating outcomes occur in which phase? Termination phase. Option C. ET. A professional nurse-patient relationship is based on mutual respect and trust. Option C. ET1. Which of the following is a therapeutic communication technique? Active listening. ET2. Which technique involves restating the patient message in nurse own words is a paraphrasing. ET3. Saying I understand how you feel is an example of empathy. ET4. Which of the following is not barrier to therapeutic communication? Using silence. 85. What does S bar stand for in nursing communication? Situation, background, assessment, and recommendation. Option A. The PQRSTU tool is used for pain and assessment of pain and symptom. Option C. In PQRSTU, what does the letter R stand for? Response. Option D. PACT in communication stand for professional, assertive, caring, timely, patient, attention, priority. Professional, assertive, caring, and timely. Option A. DAIMS is a tool used for communication in mental health. D से दिमाग कम्युनिकेशन इन मेंटल हेल्थ, तो मेंटल हेल्थ में हम DAIM वाला टूल यूज़ करेंगे. 91. व्हाट इज़ द प्राइमरी गोल ऑफ कम्युनिकेशन इन मैनेजमेंट? टू कोऑर्डिनेट एक्टिविटी, शेयर इंफॉर्मेशन एंड अचीव ऑर्गेनाइजेशनल goals. Option C is correct. 92. What is one key benefit of effective multicultural communication in a workplace? Option C. It fosters inclusivity, innovations, and better problem solving. Option C. 93. In high context cultures, communication typically relies more on nonverbal cues and the context of communication. Option B. 94. In low context culture, communication is characterized by uh, reliance on indirect message and subtle hints. Option B. An emphasis on verbal expression and clarity. Option B. 95. Which of the following is a common challenge when facing language barrier in cross-cultural communication? Increased use of non-verbal communication to overcome misunderstanding. Option B. Our reliance on slangs या idiomatic expression that may not be understood. Option B is correct. 96. What is an effective solution to overcome language barrier in multicultural communication? Avoid speakly at all to prevent misunderstanding. Option B. Use clear and simple language. Avoid idioms and jargon. Option B is correct. 97. What is a key characteristic of formal communication in the workplace? It is a casual, often using slangs. And option B, it follows structured formats such as official memos and emails. Option B is correct. 98. Which of the following is a characteristic of informal communication? It typically used for official purpose and documentation. Option B, it often occur in casual settings such as between colleagues during a break. So option B is correct. 99. Which of the following is an example of verbal communication? Speaking in a meeting or a conversation. Option C. 100. Which of the following is an example of non-verbal communication? Giving the thumbs up gesture. 101. What is the primary advantage of electronic communication? To allow the communication over a long distance instantly. Thank you. Allah Hafiz.